So let's talk about post-traumatic stress disorder. Post-traumatic stress disorder is more commonly known as PTSD. How do we know somebody has PTSD? Let's talk diagnostic criteria. This is patient A. Patient A has PTSD, but how do we know? According to the DSM-5, this patient has exhibited one or more of the following: exposure to actual or threatened death, serious injury, or sexual violence, either directly, witnessing in person, through others, or knowing it occurred to a close family friend or family member. Presence of intrusive symptoms associated with traumatic event beginning after the event occurred, such as distressing memories, dreams, dissociative reactions, where they feel as though it is recurring, intense, prolonged psychological stress, or physiological reactions at exposure to internal or external cues associated with the traumatic incident, or persistent avoidance of stimuli associated with the event, negative alterations in cognitions and moods associated with the event. This could be the beginning or worsening previous symptoms after the event occurs. Persistent and exaggerated negative beliefs or expectations about self or others. Marked alterations in arousal and reactivity associated with the traumatic event. This duration of disturbance has to be more than 1 month, and disturbance causes clinically significant distress or impairment in social occupation or other areas of activities of daily life. Disturbance is not attributable to physiological effects of uses of substances.
There is a wide range of medications used to treat the side effects of PTSD, such as anxiety and depression, rather than the actual disorder. Medications used to treat PTSD are SSRIs, which are selective serotonin reuptake inhibitors, such as Celebrex, Prozac, Zoloft, or Paxil. These specific medications treat depression, increases the amount of serotonin levels in the brain, improves mood, and reduces panic attacks. Antidendritic agents such as prozazine, propranolol, and guanfacine treats high blood pressures, relaxes blood vessels, and reduces chest pain. Atypical antipsychotic agents like risperidone or olanzapine corrects the function of nerve pathways to certain areas of the brain and balances neurotransmitters in the brain. These side effects from these medications impact the 5 domains of health by creating a barrier to participation. For example, shakiness, muscle stiffness, or weakness would be physical barriers to participation that could be overcome by using adaptive tools or by sitting instead of standing. If the client is experiencing mental, emotional, or cognitive barriers, such as anxiety or nervousness, one-on-one or small group programs may be better than large group programs. If the client is experiencing dry mouth, stiffy or runny nose, or having difficulty concentrating, then participation in a spiritual program could be difficult, but they would still observe the program without singing or reading out loud.
The symptoms of PTSD have already been stated previously within the criteria, so I will now discuss how these symptoms affect each of the 5 domains of recreation participation, starting with symptoms that may hinder participation in the physical domain. The patient may have somatic complaints due to generalized pain, an injury from the trauma, phantom pain, etc. The patient may be at a risk of physical or verbal outbursts, which may cause harm or disturbance to other patients, the TR, or themselves. The patient may be fatigued, tense, and/or display a lack of concentration due to symptoms of their disorder. Symptoms that may hinder participation in the cognitive domain. The patient may experience intense memories or flashbacks. The patient may avoid people, places, things, and situations. Some symptoms may prohibit the patient from learning, thinking clearly, forming judgment, recalling information, and/or other intellectual processes. And if the patient experiences victimization or takes things personally, some programs may be counterproductive. Symptoms that may hinder participation in the social domain. The patient may not be willing to engage with others. The patient may be triggered by certain people or groups. The patient may not be willing to display the appropriate behaviors necessary to participate in a social group, symptoms that may hinder participation in the emotional domain. The patient may not be willing or ready to engage in programs to help promote positive feelings or mindset due to overwhelming intrinsic feelings of distress, detachment, self-worth, emotional numbness, etc. Fluctuations in negative moods or emotions, or hopelessness or lack of self-worth. And finally, symptoms that may hinder participation in the spiritual domain. The patient may be experiencing thoughts of suicidal ideations, which may result in avoidance of spiritual programs or labeled as useless. Or the patient may be feeling let down or betrayed by religion or other spiritual beliefs, which may hinder participation in spiritual programs.
There are multiple facilities that offer services for individuals who have been diagnosed with PTSD. These include hospitals with acute mental health and addiction wings, mental health facilities, service dog training facilities, multi-sensory environments, rehabilitation facilities, and long-term care facilities. Recreation therapy programming, including winter sports such as skiing, snowboarding, and snowshoeing. The results indicated that PTSD symptoms decrease with the intervention of exercise-based leisure activities. As well, individuals gain stress management skills through recreation and improve relationships with peers. This is in a non-threatening environment, which helps address social isolation. Yoga interventions include mindfulness-based cognitive therapy and meditation. Results of yoga programming indicate a statistically significant reduction of stress and anxiety, daytime dysfunctional and hyperarousal, depression, and negative conditions and symptoms. Other programs include outdoor recreation using fly fishing as an intervention to reduce the psychological contaminants of stress, as well as river running, a camping program, and the activities include portaging into campgrounds and setting up and dismantling the camp, as well as cooking for the camp members. Based on mounting scientific evidence that experiences in nature can have restorative effects on the human psyche, such as increased positive feelings and perceptions of self-esteem and self-confidence, and feeling able to accomplish more physically. Rediscovering enjoyment in the outdoors, a setting that may not have been enjoyed since the trauma, overcoming negative emotions and becoming more in control, and enhancing relationships with others. The final program is leisure education programs. Through leisure education, individuals become more aware of leisure activities they might enjoy. While engaging in a psychoeducational and skills-based group, individuals learn fundamental concepts and skills such as safety, self-nurturing, traumatic reenactment, and goal setting.